This is a stethoscope. It consists of a chest piece, a length of tubing, 2 binaurals and 2 earpieces. The chest piece is positioned against the patient and sound then travels along through the tubing and the binaurals and into your ears. When you fit the stethoscope, it's important to place the earpieces facing forward into your ear canals, because that means that sound will be transmitted most effectively. This stethoscope has a double-sided chest piece. This domed side is called the bell and the flat side is called the diaphragm. We usually use the diaphragm in veterinary nursing. You can change between the two sides by twisting the chest piece. There's a small hole here in the centre, and when you twist the chest piece, it opens up. And that means that sound will now travel from this side, the bell. Twist it again, and it closes. And sound will now travel from the diaphragm. So it's important to make sure that this is correctly set up before you auscultate your patient. This is a digital thermometer, and it's a good idea to always keep it in its original case. It's got a probe with a sensor here at the tip, an on-off switch, and an LCD display, which is where the patient's temperature will be shown. You should always clean and disinfect the thermometer before use. You can use disposable thermometer covers, though these aren't commonly used in veterinary practice. This is an alcohol wipe. You'll also need some lubricant, and you just put a very small bleb of that on the tip of the thermometer, and that makes sure the patient is as comfortable as possible. Switch on the thermometer just as you insert it per rectum. This is showing L degrees Celsius, L for low. Because the thermometer isn't currently within a patient, then the temperature is below the normal body range. Most digital thermometers beep when they're ready. If the model you're using doesn't, or if it's a particularly noisy environment, then you need to give it at least 20 to 30 seconds. Keep an eye on the LCD display here, because you'll see the temperature originally climbs and then it steadies out. Once you've removed the thermometer from the patient, again clean and disinfect the probe, switch off and put it back in its original case. You should also record the temperature straight away. This is a diagnostic set, and it comprises 2 instruments, an ophthalmoscope to examine the eye and an oroscope or an otoscope to examine the ear. This is the power base, and it's common to both instruments. In this case, it's a non-rechargeable model, so this is where the batteries are held. So if it's not working, you can unscrew the base here, change the batteries and see if that sorts it out. The on-off switch is here at the neck, and you just twist on and off. And the neck is where we insert either the ophthalmoscope or the oroscope head. So to examine the eye, we use an ophthalmoscope. So we'll take the ophthalmoscope head and click it into place. In some models, you'll see a little tightening screw here that allows you to hold that in place. Switch on and off by rotating the on-off switch. This side faces you, and this is the side that faces the patient, and a beam of light is emitted from this window. Vets will use the ophthalmoscope to examine various parts of the eye. So there's a number of different lenses in this ophthalmoscope head, and you change these by rotating the vertical dial. So if you're setting this up for a vet to use, it's a good idea to rotate the vertical dial until you can see a black 0 in the window here. And that stands for the 0 diopter lens, which should allow the retina to be in good focus. Models vary a little bit, but you can sometimes adapt the beam of light to being a half beam or a blue light filter, and that can help with the diagnosis of various eye conditions. To remove, just rotate at the neck and pull out the ophthalmoscope head. This is the bulb, so if it's not working and the batteries are okay, Then we can remove the bulb, put a new one in, and see does that sort out the problem. Quite commonly as veterinary nurses, we really just want to check a pupillary light reflex. So what we need is a beam of light. So a simple way to do that is to use a pen torch. And this is just a battery operated single beam of light. So we'll press a button, emit a beam of light, and that will allow us to check those reflexes. To examine the ear, we use an otoscope. So again, it's the same power base, but this time we'll attach it to an otoscope head and use one of a series of specula or cones, depending on the size and shape of the patient's ear. So the otoscope head has a bulb, the light is emitted here, and this is a magnifying lens which gives a good view of the ear canal, and it can be moved to the side as necessary. This fits into the neck of the power base, and depending on the animal, we'll select one of these specula. So for example, for a cat, and then maybe for progressively larger dogs with longer, deeper ears. These just slide into place and twist to hold securely. It's important that these specula are made of stainless steel or plastic so that they can be easily cleaned and disinfected before and after use.